Hello everyone. Today we are going to talk about Gastro-Esophageal reflux disease. Normally what happens when we eat food? It goes through mouth, pharynx, esophagus to stomach. But here in Gastro-Esophageal reflux disease, there is backflow of food content into esophagus along with HCl due to decreased competency of lower esophageal sphincter. This can happen due to smoking, alcohol, coffee, coke, stress. These factors decreases lower esophageal sphincter pressure. So they are mainly precipitated by gastric distension. If there is short intra-abdominal esophagus, another factor here is increased gastric pressure, which happens in pyloric stenosis and diabetic gastroparesis. So there are two types of GRD: acute following alcohol, stress, burns; chronic associated with hiatus hernia. So what is the pathogenesis behind GERD? Acid reflux back into esophagus, injury, diffuse inflammation, ulcer, and finally esophagitis. What are the investigations that can be done? What are the investigations that can be done to diagnose GERD? It is barium meal. It demonstrates backflow of barium into esophagus. Esophagoscopy can be done, which reveals red inflamed mucosa at lower end of esophagus. Then manometry can be done to rule out any motility disorders and to find out resting lower esophageal sphincter pressure, 24-hour pH monitoring is gold standard to diagnose GERD. The criteria basically here is if pH of less than 4 is recorded for more than 4 times for 24 hours, then it is GERD. Normally in a healthy adult it is always less than 4 times when the pH can be less than 4. Now talking about management of GERD, there are medical management and surgical management. On medical management are lifestyle changes like reduce coffee, coke, tea intake, control obesity, avoid stooping, sleep with head tilt up, decrease alcohol and smoking. Now in pharmacotherapy or drug therapy, we have antacids, proton pump inhibitor like pantoprazole, rabeprazole, and then we have prokinetic drugs that will increase the motility of GI. They are domperidone or metoclopramide. Now if medical management did not work, we have to go for anti-reflux surgery. They have very good prognosis actually. So we have total fundoplication and partial fundoplication. It is called Nissen fundoplication, while this one is called Taupet.